Okay, I'm going to try to record this. Hopefully it's working this time. This is my fourth attempt here. I have this program I got last year or something to try to record, and I haven't used it since last year, and I couldn't remember how. Hopefully, I think this time I got it figured out. So here we go. So chapter 6, over-the-counter drugs. It goes a little into vitamins and complementary medicines, and then Appendix D and E gives some additional information. We're not going to go deep into any of this. This is just more information as nursing professionals that you need to have and be aware of and be able to assist and educate your patients. Because over-the-counter medicines, as you can see from this picture, is just a really good picture of the issue we have. That's just pain relief medicine. There are aisles and aisles and aisles and bunches of brands and all these names on it, and people just don't understand what it is. They think because it's over-the-counter that it is safe, that it is fine, they don't have to worry about it. But it interacts with lots of things. And there are like antihistamines, several different names of antihistamines that may be on more than one bottle. My own husband, a few weeks ago, when he had this upper respiratory viral thing going on, he was trying to take multiple things, and I told him, you cannot do that. And he said, well, why not? And I was showing the labels, but he didn't know what that meant. But there were 3 different things that had 3 different types of antihistamines in it. So it is very, very easy to have a polypharmacy, to have interactions, to overdose on a particular thing because you don't know how to read the labels and don't understand that just because it's over the counter does not mean it's safe. I tell people to use their pharmacist. The pharmacist is a great resource, or to teach them how to look up things. This is an example of some prescription over-the-counter drug interactions. A big one here is Tagamet, which is not ranitidine, that's Zantac, it's cimetidine, and you see it again over here, and you see it again over here. So it's one that used to be prescription. Well, almost everything up here used to be prescription, and more became over-the-counter, but it interacts with lots and lots of medicines. So it's one that I tell people if they're going to get an over-the-counter antacid to avoid cimetidine or Tagamet just because of the potential drug interactions. This slide I like in your text. It talks a little bit on page 66 about the internet. As a healthcare professional, you should be familiar with what's out there, figure out what's good, what's bad, what you're going to tell people, how you're going to direct them, because as a nurse, they will ask you, they will trust you. Patients trust you. This is how you evaluate a site. You're looking for the relevancy to what you're looking for. Appropriateness, is the information correct, appropriate? How detailed does it go? Is it too much, or is it better for a healthcare professional? Is it good for the lay public, and who in the lay public? Currency, how current is it? Is it dated? Does it tell you where they got their information from? Authority, do they give you resources? Do they tell you who they are? And when you read their background, are they qualified to give the information they're saying they give? Is it biased? Are they trying to sell you something? They own the company, belong to the company, or part of a pharmaceutical company. So those kind of things are important for you to learn and practice to know how to evaluate sites. Your text has a little box. When you get a textbook, on page 67, box 6.1 gives you a lot of information on evaluating internet sites. So here, out of these sites, you can check them, figure out which ones that work for you. RxList is my go-to. I go there quite often. You might want to check out that one. It has a lot of information. I usually don't tell my patients to go to that one because it gives more information than they would need. I go on Department of Health and Human Services. I do tell patients about that. I tell them about WebMD. I like WebMD because it brings it to a level they can understand. It doesn't go in too much detail. It is has authority It tells them when to consult their provider. Off-label use. There's your text talks a little bit of off-label use on page 69. Medications the FDA authorizes after all those years and trials and everything. They approve it for a specific use. Off-label use is when they find that it actually works on other things that has not yet been cleared, authorized by the FDA to use for that. So, but it's used that way anyway, and it's called off-label use. There is liability in that, so as a nursing professional, I would not encourage it or tell patients about that. Leave it up to the healthcare provider if they choose to do off-label. There are some things I know I do off-label for, and by using off-label, they find a need and they can sometimes get it changed over. Like Neurontin or gabapentin is one. Started as an anti-seizure medicine. It's used for neuropathy and it's used for assisting with pain management. It's used for multiple things now that they found. Not all of those are off-label use because over time it has become approved for many of those things. Okay, so vitamins. Fat-soluble, water-soluble vitamins. Let's see, Appendix D goes a lot into the vitamins. I'm trying to flip my text to get over there. I don't want you memorizing everything on vitamins, just some basics you need to know. A, D, E, and K, which I mentioned before, are fat-soluble vitamins. That means you can get too much of them. The culprits I worry about are the A and the E. Vitamin D, I don't think I've seen anybody get too much that we're actually a little deficient in it, but it is fat-soluble. Vitamin K is one where it helps blood clot. So that's one that you think of when you have somebody that is on an anticoagulant that they need to be on and you don't want them taking supplementary vitamin K. Water-soluble vitamins. This is just a good picture of the water-soluble vitamins. Like you could see all these B vitamins. This next slide I just put in here to help you with the different, which one goes with what, because you'll hear it used both ways. And that's something to be familiar with because there's certain ones, like the top ones two here with alcoholic or liver issues will be given. Folic acid, you'll learn a lot more about folic acid when you get into OB and peds because it impacts the growth tremendously there. I put this in here, factors affecting iron absorption, because that's something NCLEX likes and Kaplan seems to like about iron. So many things can block iron absorption. So again, in your teaching, you tell them to take it with some type of vitamin C source, like in orange juice. I stay away from grapefruit juice because unfortunately grapefruit juice causes interactions with numerous medications. So I specify orange juice with it. You need increased gastric acid. So although it can be rough on the stomach, you don't want them to take it with food in their stomach, especially milk or antacids, things like that, because it's going to block the absorption. Okay, so CAMS, complementary alternative medicine. Your text has a section, talks about it some on page 68, alternative therapies and herbal medicine, and then Appendix E has lists and lists and lists of all kinds of alternative medications. I don't want you to go in there and try to memorize these. I listed ones here that are very common, that can cause some complications and interactions that I thought you should be familiar with. And also the website that I would recommend you go to is National Center for Complementary and Integrative Health. It's nccih.nih.gov. NIH is the National Institute for Health. That is a site, even just nih.gov, that I go to and I used to send patients to, but it's not as easy to navigate as it used to be. but there is a section there for non-health professionals, and they can look up A to Z, look up all kinds of information on things and give them what they need. I use it for myself as a health professional. You may want to go in there. It's just an excellent resource because it brings you to the main institutes for everything, so you can get the up-to-date information on things. But this National Center for Complementary and Integrative Health, nccih.nih.gov, go in there. When you get on the site, you click on Herbs at a Glance, and it'll take you to every herb, interactions, problems, complications, meds it interacts with. Not to memorize it, but to be familiar with the site, so when a patient is on herbs or some kind of supplement and they ask you about it, you can go directly there and get the most recent information. There is the National Center for Complementary and Alternative Medicine, so we are starting to do more and more research on it. I just find this other site with the NIH a lot easier to maneuver for the information that I need as far as educating patients. I look for this seal of approval for products because they do not have to go through the FDA, they do not have to go through approval, but some go ahead and pay the money to go through this this approval process, so that you know that you're getting exactly what you think you're getting. So flipping through these quickly, commonly used herbs: aloe vera, black cohosh. Aloe vera, biggie, look here, may cause arrhythmias. So you got a patient with cardiac problems or a sudden onset of these arrhythmias. Are they taking aloe vera? I'm fine with it on using it externally. It's wonderful for promoting burn healing. Yes, it is, but I don't know about the internal. Black cohosh potentiates effects of insulin, oral hypoglycemics. I said I just put information in here I think you should key in on, because that is a big deal there. Black cohosh is great for hot flashes. I have used it. It doesn't work for everybody. They actually did studies and found that it had to do with your chemistry. So I think that's with all of these, whether it works for you. Chamomile. I'm one that does the chamomile tea. As you can see here, may have sedative effects. It doesn't put me to sleep, but it kind of helps me. I've used it for nausea before also. And you see here bronchoconstriction if allergic to daisy or ragweed, and somebody wouldn't know that. That's why being able to get in the site and look up that stuff is important. Echinacea, it's really good. They have done studies and proven it does stimulate the immune system. They do tell you not to take it more than 2 weeks. The study I found says that after about 7 days, it's not as effective. So I tell people to just take it for a week. Evening primrose helps prevent cirrhosis, eczema, PMS. I have seen it work on some people with the cholesterol, and I have seen people with chronic joint inflammation that it has helped. And again, it helps some and doesn't help others. Feverfew interferes with platelet aggregation. That's a statement you will see on a lot of these herbs, which is significant with platelet aggregation. Not just if they're on like a Plavix or something to make their platelets slippery or something. If they have a platelet issue, thrombocytopenia chronically, where they have low platelets, you wouldn't want them on something that interferes with platelet aggregation. You also would want to know that if they're on any of these, to stop them a week or two before they're going to have surgery or any kind of invasive procedure, even in their mouth in dental work. So that's a big factor. You see here with garlic, decreases platelet aggregation. Again, I have seen people use it for their cholesterol, that it has made an impact. Garlic is one of those ones they seem to need enough of it where it comes through the skin and you smell like garlic. So that's but it does have some good uses if you can tolerate the smell. Ginger stimulates digestion, which it really does. It's actually really good for nausea. I tell people like during pregnancy and other times to get some ginger or ginger snaps, because it helps calm the stomach. But again, it decreases platelet aggregation. Ginkgo biloba, antioxidant, peripheral vasodilator. increased blood flow to the central nervous system. I remember hearing about this when I was in college. You're talking way back, 1979, 1980, taking it to try to help with my brain. I don't know if it worked or not, but I know I took it when I was in college, took it for years. Here we go with the decreased platelet aggregation. I said you would see that a lot. St. John's wort, antidepressant, antiviral. I have seen that, but again, it takes 4 to 8 weeks to be effective, but it can cause a serotonin syndrome if they're on an antidepressant. And again, you want to tell people, don't just stop taking your medications and go on this without talking to your healthcare provider to go off appropriately, if it's appropriate to go off. Did I just do... St. John's wort is listed twice. Okay, we'll go to valerian, or valerian root is what I'm used to hearing it called. Sleep-inducing herbal Valium, that is what I have heard it called. I've not seen people addicted to it. It works for some people. You just have to worry about any interactions, and it does have a terrible smell. This dirty socks odor has a terrible, terrible smell. These are just tips for you in teaching and remembering not to take herbs if pregnant, nursing. Don't give them to infants and young children. People do. Don't take large amounts of them. Always talk to your healthcare provider. Make sure the product tells you what is in it, and I look for the seal of approval. And hopefully this one recorded this time with my 4th try, and I will be talking to you on the next recording.